Good morning and welcome. My name is Steve Anderson. I'm the Chief Operations Officer for Liberty Public Schools. And I'm going to walk you through 15, 20 minutes or so, an overview of where we've been over the past several months as we work through planning and preparing for our COVID response and preparing for the return to school here in the fall, and then actually look forward to next semester and some of the conversations we're beginning to have in and around that. So real quickly, I'll give us a starting point here of the work we've done. And so it really began back in early February, and that's when the district first became aware that this was something that we're going to have to monitor very closely. Our district leadership team was very engaged with Clay County Public Health right out of the gate, and thankfully we have some connections with them, and began to kind of better understand that this may be a situation that was going to maybe disrupt our lives for a little bit. It wasn't known for sure yet, the full impact, but we knew it was something we needed to start preparing for. In March, obviously, when we had spring break, and then coming out of spring break with shutting down for the remainder of the school year, at that time we began to have more consistent and regular conversations with our public health officials and many other partners that are identified here. The CDC is obviously the foundation to much of the work in and around the response and preparation. Both Clay County Public Health and Kansas City Mo Public Health were very integral into our work. And as a reminder, half of our district lies within Liberty, the other half lies within Kansas City, and so there was a little challenge in kind of coordinating with two different public health agencies. We also have been in regular contact with Children's Mercy, and they've been very helpful, especially we'll speak to here in a few minutes as we handle symptoms that are popping up from time to time within our buildings. The American Academy of Pediatrics has been also helpful in some of the work that they've done, as well as the Department of Elementary and Secondary Education and the Missouri School Boards Association, and more specifically an arm of MSBA, which is the Center for Education Safety. All have prepared plans and guiding documentation to help us as we began our work in preparing for both spring, summer, and then the fall. In April, we had our essential staff return to work and really began to make sure that we were kind of keeping things moving across the district. And then in April, early April, is when we brought together what became our reentry committee, and we began to meet on a regular basis with a fairly large group of folks that I'll kind of spell that out here in a minute. So we knew right away that we had to kind of prioritize our focus, and so a couple things popped up quickly. The first and highest priority was the fourth quarter emergency learning that took place, which moved everybody to online instruction. We were thankful that we had the one-day snow day experience, virtual learning at home that we implemented just a month or so prior. That became very handy as we look to scale that out over the coming days, weeks, and then of course beyond that. And then we were also thankful that voters approved a few years ago a bond that allowed us to do a one-to-one device for all of our staff and students, which made that transition viable. So that was helpful. And so of course, as part of that, our technology team and providing access and support to families as we transitioned for the remainder of the fourth quarter. A couple other things that we were focused on right out of the gate. We did some emergency patrol teams, both within buildings and in and around sites. Our safety and security team and then our facilities and maintenance staff were in spaces on a regular basis. And a lot of this was just to make sure that nobody was, there were no pipes leaking, that sort of thing, and then to make sure that there was nothing happening on any of our sites that was not compliant with the order issued by Clay County Health. The other work that we were very focused on right out of the gate was the feeding of our families and students, their students. And so shortly after we decided to shut down after spring break, we began a pretty robust program where we were serving families from several of our school sites and then also providing delivery. And so led by our nutrition services department over the course of not only the fourth quarter, but then in and through the summer, we have served over 250,000 meals to the students within the district. And so really appreciate the teamwork there and the commitment to keeping that program moving forward through the course of the summer. The next step of this process, as I mentioned a minute ago, was in really putting together the team that would lead, the district leadership team that would lead the replanning or planning for reentry. And so we initially set up one group that came together and were meeting a couple times a week. We soon realized that we needed to set up a handful of sub-teams or subgroups to work through some of the more particular specific issues. And so we had a group that was focused on the reentry in fall. We had a group focused on summer school, also a group focused on summer activities and events and camps. Our group focused on returning to work. Another group on facilities use, also on procurement. And then lastly, our operating procedures or baseline or foundation plan, which I'll speak to here in a minute. And so all those groups began to meet regularly. We reported out as a larger group once a week just to make sure that we were covering all bases, and then also very significantly to make sure that all these various efforts were working from the same foundation and we were all on the same page. So I mentioned the foundation. So one of the things that we realized, and this was where we had to work most closely with the CDC and the Clay County and Kansas City public health departments, is just to make sure that we were all on the same page when it came to distancing standards, mask wearing, hygiene requirements, and so on. And so we put together a document early on that we amended from time to time that really served as that consistent message across the district and all those plans that I just referenced to make sure that we were all on the same page as it relates to bringing folks back into our spaces, whether it be for summer school or athletics or what have you, or staff for that matter. The other thing that was more imminent is we knew that with spring and summer we needed to get a couple things knocked out pretty quickly. So we did put together a team that worked on summer school and what that might best look like. And then we also worked together for athletics and fine arts and how we might be able to keep some of those programs operational as we hit the summer. The middle section here, which is obviously not very legible, was also a very important part of that early work, and that was our procurement planning group. And that team began meeting very early, kind of in April, and spent a lot of time trying to get to the front of the line in procuring, purchasing items ranging from masks to PPE more broadly or generally, hand sanitizing equipment or hand sanitizing stations, along with maybe new desks and furniture and other items. And so we began that process to make sure that we were, one, coordinating our purchasing, but then trying to get in line as quickly as possible because we knew that there would be some delays in shipping and so forth. The next step that we took on was community engagement. This obviously was a very critical and important part of our work, and it began with a couple surveys that we sent out, one in April and one in May. Then we also began a series of focus group meetings, targeted group meetings with several with parents and families, and then a couple with staff as well. We also embarked on a little project where we were calling families and students directly just to have that more one-on-one conversation. We opened up a communication portal on our website called Let's Talk that allowed everybody within the community to reach out to us with any questions or concerns they might have. And then, of course, for those who are on our email lists, have received numerous district communication emails, broadly speaking, to where we were at and where we were heading with respect to reentry in the fall. And then last, of course, our website. We've kept that updated all along the way and updating our frequently asked questions section, which seems to be one of the more highly referenced areas of the website. So off of those surveys and the work and conversations with the community, it became apparent what our objective was, and we knew this. We knew we were heading down this path, and that was, one, to allow families choice, knowing that every family is in a little bit of a different situation, but whether or not they wanted to come back face-to-face as soon as it was safe to do so, or if they wanted to continue on within a virtual experience. And so to help inform that plan, we prepared and sent out a student census requiring every family who had a student in the district to identify their preference, whether it be virtual or face-to-face. And with that, just anecdotally, which is interesting, we had many families where with multiple students that would choose, maybe one student would choose face-to-face and the other virtual. So it wasn't, every family wasn't all on the same page, but that whatever worked for that student was the direction I think a lot of families took. And then, of course, our overarching goal has been and always continues to be is to safely accommodate as many face-to-face students as is viable. And that was always one of the main objectives driving this work. And then, of course, preparing accordingly once we knew what that plan was. This is a quick reflection of the census that was sent out. We continue to update this based on actuals, but those numbers are essentially it's about an 80%, 19%, 80-20% split between virtual and face-to-face. So once we had a sense of the numbers of students that were wanting to come back into school, we began more of the operating process of making sure that we were prepared. And so our committee that worked very closely in all this, all these efforts, included all the major departments across the district. Academic services was clearly involved, and we had representation from all three levels, elementary, middle, and high school. Our safety and security department, our facilities department, procurement, which I mentioned a minute ago. Of course, transportation became critical to make sure that how we were transporting students, how many on a seat, that sort of thing, make sure our routing was in place. We actually requested that all students opt into transportation this year so we could better plan our routing. Nutrition services, as I mentioned, not only were they serving all through the summer, but in preparing how best to serve students once they're face-to-face, but then also providing meals for those families that had chose virtual. School-age care continued to be a challenge, but we've kind of met that challenge to make sure that those families that need that before or after school care have that opportunity. Technology has been critical throughout. We've had on occasion some students or families that have had some challenges, and we provided hotspots to those in need to help them get better service to where they're located and continue to serve those needs that pop up from time to time. And then I can't say enough about our health services department under the leadership of Kathy Ellemeyer and her working very closely with the health departments, just ensuring that all of our safety protocols were in place to make sure that we were answering questions that may pop up from time to time to ensure, again, compliance and consistency across the system. The other thing we did about early on, or maybe midstream, was we decided that it was critical to have somebody completely dedicated to this work as we rolled forward. And so we did assign one of our building principals, Chris Gabriel, who was a principal at Lilly and Schumacher. We asked, and he accepted the role of Director of COVID Response. And so he has been that liaison between the buildings and operations and basically all things related to COVID and planning. He has been integral in all that work, and so we were very glad to have him on board. And he'll continue to work with us over the coming months. We then began a building-by-building assessment to see what our space needs were or challenges were and how much we could accommodate across the system, K-12 or pre-K-12. And then began to look at building preparation, everything from sanitizing stations and spacing of desks to make sure distancing was in place, and just all the particulars that would come with being able to safely accommodate students as we rolled back in the fall. And then system and protocols, and I'll speak to that in a minute, so that we were fully prepared once students were in place and staff was on board, that as any particular issues were to pop up with respect to a COVID infection, that we could then respond appropriately and accordingly. So the actual return to learn plan has two main components to it. We have the in-person, and where we landed this is pre-K to 5 has 5-day instruction. About 4,500 students are in that program, and they're, like I said, they're in class every day. We have managed, based on some of the planning we did, to keep all of those students, with the exception of the Early Childhood Center. All of their students right now are able to receive instruction with appropriate distancing in place. And of course, they're all wearing masks, but they have that 6 foot of buffer between other students and staff. 6 to 12 was much more of a challenge in doing that, and again, bearing in mind that they're more susceptible or they are more readily transmit COVID to one another. We decided to put an A/B schedule in, so students are in 2 days, 1 week face-to-face, and then they have the Wednesday off, and then the B students are kind of alternating on those off days for A students. And so every student is in face-to-face 2 days a week, and then virtual days 3 days a week. And that totals about 5,900 students at the 6 to 12 grade levels. And then for those families that chose virtual fully, we did it. We do have a dedicated virtual staff, and our scheduling is all synchronous with the system. And then in that program, we have about 2,400 total students who are fully virtual students within our program. I kept on slide here, these are all available online, but these are the actual planning documents and the support guides, action guides, and schedules that are part of that plan. This would be version 2.0 of that plan. The next thing, and this is all kind of happening at the same time, was the operating standards for the actual introduction of students and staff back into schools. And so, led by the three principals that guided our operating team, Scott Carr at the middle level, Chris Gabriel at the elementary, and Rosemary Camp at the high school, they helped put together playbooks for each level that kind of outlined all the critical areas to focus on, always ensuring alliance with those operating guidelines. And then each building put together their own plan based on that general framework. And again, that was to ensure compliance and consistency, but then certainly give them some leeway, knowing that every building is a little bit different, and giving them some flexibility in how they could best educate their students. And so far that has worked out quite well. So now pivoting to actually having students in buildings, we before that started, we had to iron out all of our protocols and processes as it relates to responding to any COVID situations. And so we prepared a couple guidelines or documents that are on the website. The first is the communication protocol and how we do the contact trace and how we then communicate out any results of that contact trace when a COVID-19 exposure is made apparent to us. And so that work is all outlined within that document. And then the second document on the right side of the screen here is the actual symptom guidance. This we worked very closely with Children's Mercy and to make sure that we were responding to and managing anybody who may have symptoms that may or may not be COVID, just how we manage that and when they have to stay out of school and what those protocols and procedures would be to allow them back into school, depending on, of course, whether they were determined to be COVID positive. And so that's a really great document for those who want to kind of better understand how we're operating within the current system. And of course, this has been it's been a busy time. Our building leadership teams are all put together their own contact tracing teams, and whenever there's an incident that arises, they assign a lead tracer who then begins the process to ensure that we are properly following that CDC and Clay County KCMO Public Health guidance, and that we are properly tracing and tracking anybody who is COVID positive. And so one side of the screen is a checklist to help the staff who's running that effort. And then once they've kind of put together all that information, they enter it into a form that allows us to trap and track all the appropriate information that then allows us to put it into a reporting mechanism. So all that information then generates a series of reports, whether there is a COVID positive individual or a close contact. And then the other component to that is whenever there is a COVID positive individual in a school or one of our buildings, it generates a quick email to our custodial team to ensure that they can go in and deep clean any areas of which that individual was within for an extended period of time. Communication is also a key component to this, and we decided early on maybe to over communicate a little bit. And so what we do is we certainly communicate formally with anybody who's COVID positive. You give them proper guidance on what they need to do and when they can return. We also have to identify anybody who is a close contact. So not only are they receiving these letters, but they are also receiving phone calls, typically from either human resources, if it's a staff person, or from the building leaders at each school site. We're also, whenever there is a COVID positive situation in a building, we also send out a courtesy notice to all the families and staff within that building, just to let them know, because we know that rumors can swirl, but just to let them know that, yes, indeed, there was a situation, and basically notifying them if they have not been specifically identified as a close contact, there's nothing to worry about. Just always monitor yourself for symptoms and follow those processes if any symptoms come up accordingly. And then the last thing we do in the lower right-hand corner of the slide is we then also communicate and send all this information directly to Clay County Health or Kansas City Public Health, depending upon where the situation is, just to let them know what we have found, and then to assist them in their contact tracing processes that might need to occur beyond the school site, right? So we're focused obviously primarily on the school situation, but knowing that the county is interested in that which occurs beyond that. And so we close that loop with them as well. We also have, we're in our 4th week, I believe now, of putting a dashboard on our website. If you're interested in kind of seeing how these numbers are coming across so far, the dashboard offers a pretty decent representation of that. We update that every week, late Wednesday afternoon for the preceding week. So we're kind of working a Friday to Friday. So there's a few day delay before you get last week's numbers up and running. And so far, I would have to say, generally speaking, we feel pretty good about where we're at against what we were expecting. And our main goal, one, is to accurately represent what we're experiencing, but also really to focus on that area which is really the area we probably have the most control over, and that is how many close contacts are identified once there is a COVID positive individual that actually comes into the school setting. And so because we have put together our plan that requires masks and distancing and hygiene and so forth, we feel like we're in a pretty good position where there aren't a lot of situations where distancing is compromised, and therefore close contacts should be fairly minimal. And so towards the end of the dashboard, you'll see some numbers where it refers to in-district cases and in-district associated close contacts. That's really the numbers that are the ones that we're probably most focused on, because those are the ones, like I said, that we probably have the most control over. And then there's a chart at the very bottom to show some trends developing over time. We're also looking at gating criteria, working closely in partnership with the Mid-America Regional Council, Clay County Public Health, the other health departments across the metro and region, and really trying to identify certain standards in terms of when it might be safer to either scale up or when maybe things are not going as well and we might have to think about taking it in a different direction. So we're still working through some of these issues. It's a little complicated because much of it's dependent upon testing and how many tests are out there and how readily available they are and how many tests we're giving to asymptomatic individuals to really kind of balance out some of these numbers. But what you'll see here is some of the primary criteria are the number of new cases per 100,000 persons, the trend line in new cases over the last 14 days, and then the ability for the schools to implement proper mitigation procedures. And then the last primary criteria is the percentage of persons testing positive for a 2-week period. And so these things are still fine-tuning these, but we are keeping a close eye on that because that might guide us as we roll forward into the coming months. And the last thing I was going to mention here before we close out is what's next. And what's next for us is our team is re-engaged, and well, we've been fully engaged from the beginning, but we are now focusing on that look forward. And really, what does version 3.0 of Return to Learn look like? As I mentioned, we started out, the initial version was 1.0, where it just kind of created a little bit of a framework for what this might look like. We revised it to 2.0 when we realized that we were going to do the face-to-face K-5 for 5 days and then the hybrid schedule for secondary. So 3.0 was basically a look at what next semester might look like. And so we began having those conversations not only internally, but also with public health officials We're looking at taking a closer look at our space across the system, especially secondary, to see if there are other opportunities in there to scale up, or at least prepare a plan that would allow us potentially to scale up next semester, if again conditions would allow and if it was safe to do so. So we are working actively at that and feel pretty good that over the next month or so we'll have a pretty good plan in place that we hope to put into effect as we roll into next semester. And really can't stress enough how important it is. We understand the importance of providing opportunities for all of our students to have face-to-face instruction for those who choose to do so, and also having our virtual school perform at the highest level as is appropriate. And so we have a lot of good folks that are spending a lot of time working through those plans and again looking ahead as well. And so that really concludes my presentation. Again, can't thank you all enough. I know this has been a challenging time, and we get it. Many of us, including myself, have a student in the system, so we're living it in a couple different ways. But really recognize the importance of providing a safe learning environment for all of our students, keeping them socially active as much as is possible, and hoping here in the coming months that we can pivot back to as normal as possible, because I know that's where everybody wants to be. And so appreciate this time. If there's ever any questions or comments or feedback, certainly would welcome that. Direct that to district offices or to our website. And then stay tuned. And one last thing, I know many of you have seen the survey. We just sent out another survey as we're looking forward to preparing for the 3.0 version. So please take a look at that, fill that out. We've sent it to not only our families, but also to our students and staff. So thank you very much.